Listening to 1059 The Region, and this is Health is Wealth with Dr. Mike Carrozza. I'm station manager Tina Cortez. On the show today, post-traumatic stress disorder, especially for those who have dedicated their lives to serving others. That conversation is coming up later in the show. But over to Dr. Mike with today's first guest.
Thank you, Tina. As you know, obviously we all know that most of the province is now in stage 2 of the reopening. While most people are relieved about this, this is finally something in which that we can finally start getting out into the workplace and into our regular day-to-day. The return to work brings on the feeling of anxiety. And this anxiety is actually something that has stricken a lot of our Canadian citizens, and especially people in Ontario, is that, we're worried about transmission. We're worried about, can we loosen up? And how does this look? And then, what are the new normals that we have to accomplish in order to have a safe environment? Okay, so joining us to discuss this further is Nigel Branker. He's the president of Health and Productivity Solutions from Morneau Chappelle. Welcome to Health as Wealth, Nigel.
Thanks, Dr. Mike. It's a pleasure to be on the show.
Well, thank you very much for joining us. I mean, obviously, this is a huge topic as it pertains to people feeling anxious about their returning to work and whatnot. But tell us a little bit about your work at Morneau Chappelle.
Sure. So Morneau Chappelle is the largest provider of well-being and mental health solutions in Canada. So we support a wide range of people and clients, really from every spectrum. Most recently, we've partnered with the governments of Ontario and the government of Manitoba to offer free mental health support to all Ontarians with respect to anxiety, and particular anxiety driven on as a result of COVID-19.
And can we talk specifically then about what types of supports are available for those who are feeling anxious about returning to work?
Sure. So maybe I'll take a step back, and when we talk about anxiety, there are many stressors that might contribute to you feeling anxiety. And so what we're talking about is, as Dr. Mike said, you might be worried about going back to work. You might be worried about being safe. You might still be worried about loved ones in elder care facilities. You might be worried about what your kids are doing. So there are many sources of anxiety. What the support that we've partnered with the government to provide is really helping people to build the skills to cope with anxiety, so better understanding how those symptoms show up for you and how we can help you to really first have some short-term counseling support, but more longer term to build up the skill set to be able to cope in a good way. Our point of view is, and our data supports this, that as we've gone through COVID-19, a significant majority of Ontarians have felt that their mental health has been negatively impacted. Our latest survey in May showed that 73% of people felt that their mental health has been impacted by COVID-19, and about half of those are not sure that they can cope. So if you think about now returning to work with that mindset, we actually saw it more pronounced with people who've seen their salaries reduced or seen their hours reduced and are worried about making ends meet. So this is a group that's at risk, that's now returning into the workplace, into in totally new environment. So our role is really to make this type of support available for people to have someone to talk to, but to also go through a really structured digital program at their own pace, again, fully sponsored by the Government of Ontario, to help build up that resiliency and have support as they return to work.
Well, I think, obviously this is amazing because, first of all, to have the support in place, a lot of people have issues in terms of how they could navigate the waters, because some people and for our listeners out there, of course, anxiety is maybe something you've been suffering for a long time, or, this could be new for a lot of people, right, Nigel? I mean, I guess this is some of the nuances that we're experiencing today with this COVID-19, that more people either they maybe had symptoms of anxiety, but more anxiety now are coming out more than ever, and not a lot of people know how to cope with it. And so some people maybe cope with it by not speaking or not talking, or maybe they don't want to discuss it, and that can actually be worse, right?
100%. And I think you hit the nail on the head. When it comes to coping, listen, I think the number one barrier is, as you said, is a lot of people still feel stigma, right? They still feel like mental health, should I be getting help? What's wrong with me? The reality is, at least 1 in 3 Canadians, if not more, suffer at some point in their life from some sort of mental health or some sort of anxiety. The challenge is we haven't been really taught how to cope, and as you've said, right now there are more things driving anxiety. There's also, some of our supports are no longer there. So if personally, I normally spend every Sunday in the summer playing soccer in a Markham league. I'm not going to be doing that this summer, right? So not only are there more stressors, but some of the things that are normal that give us comfort, that help us to cope, are probably no longer in place as well. And that combination is what's creating a lot of strain for a lot of people. So I do really worry about people being gentle with themselves and taking advantage of some of the supports like our ICBT program to get the help. And maybe as a closing point, at a personal level, what I've learned through the program is one of my bad coping techniques, and everyone has bad coping techniques. That's why we see things like an increase in drug and substance abuse, or an increase in domestic violence, or just more people yelling at their partners and their kids. That we all cope in bad ways. In my case, I tend to assume the worst. So throughout COVID-19, if I got a sore throat, my brain would quickly go to, that's it, I'm going to get sick, I'm at risk, I'm going to die, I better update my will. So you get there really quickly. And what's not helpful is for someone to say, hey, that's not really rational, because we get it, but that's still how our brains work. So going through the program really helps to build up that skill set. And even though the stressor was COVID-19, it applies the same in the workplace. I get to the same conclusion if I'm late on a report. Then I may go, well, I was late on that report for my boss, therefore I'm going to get fired. So those are examples of sort of unhealthy ways of thinking and coping, and then it just leads to more and more stress, and then it shows up in your behavior and your interactions with your loved ones. So again, our ICBT program is really geared towards helping people build good ways of dealing with anxiety. We can't remove all the sources of anxiety in your life, but we can help you cope and deal with it in positive ways and build good habits.
And just to get on that note, just for our listeners, there are certain symptoms related to anxiety. I'll touch on a couple, of course, that I see in clinical practice is that, heart palpitations, shortness of breath, cold sweats, ringing in the ears, these are pretty much the symptoms to watch out for. And if you feel this, obviously it's quite similar than someone may even feel like they're having a heart attack. And I know in the ER, it's very challenging at times, depending on the age of the individual, to distinguish between in the workup between somebody having a cardio workup versus an anxiety workup, because they're similar. You feel that chest pain, it's that palpitation, you can't breathe. And so, these are, obviously, this is symptoms to watch out for. And just for our listeners, that there is help, and these are great tools to look at. And then when you think about triggers, I'd like to just touch base on triggers, right, Nigel? There's, like you just mentioned, is the substances. And of course, 3 main triggers that I talk to most of my patients about is alcohol, for sure, is a big trigger of anxiety. Some people think that it'll actually help anxiety, and for the short term it does. You'll have that glass of wine or you'll have that alcoholic beverage, and for that 1 minute or that 5 or 10 minutes you'll feel fine, but the next morning you're on edge. And that's why alcohol is very, very risky, and how it actually will cause some triggers. And then chocolate and coffee are other triggers as well, because they give you the jitters, if you will. And so these kinds of jitters will actually stimulate the heart and maybe have you have more of a anxious, almost like an anxiety, like an episode. And this sort of panic disorder we didn't really talk about, but this is more triggers towards that. So, for our patients who are experiencing these are some things that maybe you want to avoid. Okay, so if our listeners want more information, Nigel, where can they find it?
So it's really straightforward. Best place is to go to our website. The website is myicbt.com, myicbt.com, and you'll get more information about our product and how we're there to support you and help you. And there's just a link to identify that you live in Ontario and you're eligible for the service free.
That's great information, Nigel. Thank you so much. Over to Dr. Mike with our next guest.
Well, thank you, Tina. Our next guest is MPP from Vaughan Woodbridge. He is also the Associate Minister of Mental Health and Addictions. Minister Michael Tibolo, welcome to the show. Thank you very much. We share a common name. I'm a Michael as well, so that's wonderful. Thank you for coming on the show.
It's a pleasure to be here and to have an opportunity to speak with you.
You know, let's begin. I mean, we're talking about the frontline workers, and these individuals, of course, you know, we ended off our previous segment, which was about anxiety, and you know, obviously this mental health is a big concern, and so, you know, let's begin with, you know, why are frontline workers especially at risk of PTSD, which is post-traumatic stress disorder, which is a very, very common. I see it a lot in practice, and I'd just like to hear more from you.
Sure. Well, post-traumatic stress disorder is something that affects the front lines. It actually affects everyone. One of the concerns we have is how it will impact on children, not today, but when they get to 12 and 15 and 18 years old. A lot of trauma that they are exposed to doesn't necessarily manifest itself in how they react to day-to-day situations. Some of them may be anxious, they may be depressed. The fact that they haven't been around their friends and in school and in structured activities will lead to them having those types of potential issues later on in life. So it's really important that anyone, children, men and women that are working, that are having financial difficulties, frontline workers especially, given the fact that they see things that we normally do not see, our frontline, the first responders as well. All of them, because of a shock to the system, impacts on them the way, if you broke your leg skiing, it impacts on the mind in many ways. And people need to have help. They need to have someone to talk to. They need to have supports in those difficult situations. So I'm very happy that the government, under the leadership of our Premier, invested money to make sure that those not only for all of us as individuals living in the province of Ontario, but our first responders and our frontline workers have access to services to support them in these difficult times.
And Minister, can I ask you then, how will you engage first responders or frontline workers? How will you get them involved and able to access the help that they perhaps don't even know that they need?
Yeah, and of course, because of the stigma attached with mental health, even to this day, a lot of them will feel that they have to suck it up and they shouldn't be looking for help. We've embarked on a campaign where we are telling them and helping them understand that it's okay to ask for help. There are helplines that have been established. I'm very proud to say that we have internet-based cognitive behavioral therapy to support individuals as well. I mean, the pandemic has done an incredible disservice to all of us in that social distancing or physical distancing has created situations where we can't go and see someone. So the only real resources we have are the ones that are available online. And ICBT, we've had a huge uptake in terms of its use by the general population in Ontario, but specifically there are programs that have been built for our frontline workers, and they're confidential, they're free of charge, and open and available to anyone. And we are seeing uptake to our frontline workers through those programs. So it is working. Is it the best possible? Probably, face-to-face options are always very much needed for some individuals, and that unfortunately wasn't happening early on. But now as we open up the economy and we move into the Phase 2 and soon hopefully Phase 3, more of those types of services will be available to everyone.
Well, I mean, we always talk on the show, and to your point, Minister Tibollo, we always talk the point about on the show as in terms of what COVID-19 has done, and post-COVID-19, some of the concerns, and predominantly we always speak about mental health because I'm seeing it in my practice, and for sure, whether patients are not having mental health or the PTSD. But one thing that I love is that cognitive behavioral therapy you mentioned. I mean, I know it's internet-based, but still, CBT, and I'll repeat this in terms of the literature. The research that actually is behind CBT is profound. I mean, they've done, so for our listeners out there, cognitive behavioral therapy is right up against, and actually, trumps a lot of comparable to medications that have been prescribed for mental health. And CBT, cognitive behavioral therapy, is triumphant, if you will, in terms of how it's able to help individuals. And like you mentioned, and the research shows that whether it's an in-person or not, it's pretty similar. And the fact that there are resources like that available, kudos to setting things like that up, Minister Tibolo, and I think that is a huge win for not only our community but our fellow Ontarians and all the frontline workers that have put themselves first and risk themselves literally, not only just for this COVID-19, but obviously this is something that they do on a day-to-day. And to know that we have the support system in place for them just makes me as a practitioner feel really, really good. Because, by the way, CBT therapy is very expensive. It's one of the things that a lot of people have turned away from. So to have something like this and these resources for them, I think is tremendous. So thank you.
I appreciate that. And the ICBT that is in place now is also going to be supplemented. The Roadmap to Wellness, the plan for mental health and addictions in the province of Ontario. I worked very closely with teams of people that are experts in terms of delivery of services, and I have a background in working with addictions as well. When we started looking at cognitive behavioral therapy, it wasn't just internet-based, and we do have the system now that's been set up and available to all Ontarians, where you can go see a practitioner, a doctor, a psychologist, a psychiatrist, a nurse practitioner, masters of social work that are trained in cognitive behavioral therapy. And the outcomes are incredible. We modeled it. We're the only jurisdiction in North America that has cognitive behavioral therapy that's paid for by OHIP. And we copied, if I can use that word, the system from IPAT, the English system that has now been in effect for, I believe, over 13 years. And the numbers that we see with the use of CBT, I believe that mental health can be gained through talk therapy, through the delivery of cognitive behavioral therapy. And it's proven that in England, 70% of the people that took the program actually were cured of their cognitive and behavioral issues because it was so profound and so intense. 15%, in addition, felt that they were better off having taken the program. So it's highly effective. It's structured, so it provides help to everyone, regardless of the line of work that you're in. It's good for men. It's good for women. It's just, in general, a very good way to deal with, the most common types of mental health issues, which is anxiety and depression. So I'm really happy to be the person who is in charge of mental health and addictions for the province, having brought this forward. It's an investment of over $20 million as a first round, and it's something that's going to continue so that it'll be there for everyone anytime. And again, it's completely confidential. And, if we can get people to understand that there's nothing wrong, you wouldn't hesitate to go see a doctor to set your leg if you broke it. Why is it wrong to go and speak to someone and get help if you're having stress and it's leading to anxiety and depression? So we have to get over that hurdle, and especially our first responders, and if they're listening, our frontline workers, you are all heroes in our society, and we have benefited greatly as a result of the sacrifices that have been made. I know of some frontline workers that haven't hugged their kids for 4 months, and these are young children, for fear of infecting them. I mean, they've made a lot of sacrifices for all of us, and our government is anxious to make sure that we have the resources in place and that people are taking advantage of them. Because again, in health, when I got here, they started talking to me and saying, you're going to be responsible for the orphan child of the healthcare system. It'll be in mental health. And I said, well, mental health now has an advocate. It has a father, a papa who's going to make it very clear that there's nothing wrong with getting those supports and that help. And we have a lot of excellent trained professionals that can do an amazing job in helping individuals with these issues. And mental health leads to health, and you can't be healthy, and I think you'll agree with this, doctor. You can't have health if you don't have mental health.
Absolutely. And, just chills down my spine as you mentioned that, because it just makes me proud, not only as a Canadian, but as an Ontarian as well, just to know that that kind of support system is in place. Our government is actually thinking of the best interests, and it just goes to show what Canadians are really about in terms of helping others and ourselves. And so I'm grateful, and I know a whole bunch of my patients and a ton of frontline workers. And so to all of you out there, we thank you, and we continue to cherish your support to our community. And before we go, Minister Tibolo, where can listeners go for more information?
Well, the first place I would suggest going is to ontario.ca and having a look at what's available there. That will give you access to the two streams of cognitive behavioral therapy that are available today with Monel Chappelle, and the other one with Mind Beacon. So both programs are available, and again, free of charge. In addition to that, there's a Kids Help phone that I would suggest, a website for any young listeners under the age of 18. And then there's Connects Ontario for adults, connectsontario.ca. There's Bounce Back that's got a great program that helps frontline workers. They're Bounce Back Ontario, all one word.ca. Kids Help Phone, I mentioned, it's Kids Help Phone, all one word.ca. And there's another one for post-secondary students, Good to Talk On, and that is a textbook that can be used if they don't feel like speaking to anyone. And teenagers, for some reason, really are using it quite a bit. So those are the places they can go. In addition to the best place, though, is Ontario.ca, because it will give access to all the programs around the province, including Big White Wall, which is specifically set up to help our frontline workers. So there's a lot of resources. We've invested a lot of our money, of our taxpayer dollars, into making sure that all these services are available to every Ontarian, no matter where you are in the province of Ontario. And by the way, if you use one of the helplines and really would rather be in front of someone, there are all those options available. Now that we're opening up, it's not restricted strictly to virtual mental health care. You will be able to see professionals, and my job now is to make sure that the wait times are short, so that people get the help when and where they need it. And again, thank you for giving this opportunity to bring more awareness to the public, because this is really, really important. People have to know that the services are there. And women need to get more help, because we're seeing through the numbers that they're suffering quietly, being moms, being spouses, partners, being educators now. The stress on them is the highest it's ever been. So for the women out there, please get help. There's nothing wrong with speaking to someone and get some release from some of the stresses that you're having to deal with all the roles that you have to play each and every day in your family and in your home and in business.
Very true. Thank you, Minister Tibolo. That was great. And thank you. These are all very rich resources where we can go to for help. And Dr. Mike, just before we wrap up the show, if our listeners want to connect with you or want more information about AppleMed, where can they find it?
They can call us at, we're here for you, of course, 905-417-4000. We're located at 3560 Rutherford Road here in Woodbridge, Ontario. They can see us online at applemed.ca, or they can check us out on Instagram and YouTube at AppleMed Clinic for our shows, and they can sign up to see and hear some of these shows as well. So thank you.
That's our show for this week. Previous episodes of Health is Wealth on 1059theregion.com. Thanks for listening.